When performing a physical examination on a conscious cat, all the key principles of cat-friendly handling can be used. Have the cat on a comfortable, non-slip surface and keep it facing away from you whenever possible. Let the cat choose its position and work around it rather than trying to make the cat conform to your plan. If you have an assistant, or if the owner is present, they can help to keep the cat still by stroking its head and neck, but keep restraint to the minimum so the cat doesn't react against it. When you need to have the cat facing you, your assistant can use his or her arms and body to lightly control the cat. Holding the forelimbs above or around the elbows keeps control of the forepaws without needing tight restraint. Stroking the pheromone centres in the pre-auricular and the zygomatic regions and stroking the bridge of the nose can have a calming effect. If a cat is very fearful or uncooperative, you can try to do as much of the examination as you can while the cat is more relaxed in the carrier. Start with the least stressful parts of the examination first. Take a moment to establish a rapport with the cat, stroking and talking to it while you run your hands over the torso to assess coat and body condition. You can find the femoral pulses and feel for external wounds or skin lesions, but leave examining the ventrum until later, as many cats may not like this. For thoracic auscultation in a relaxed cat, keep it facing away from you and stroke the pheromone centres on the head, or place one hand on his sternum to stop the cat moving away and to control the forelimbs if necessary. Always use a paediatric stethoscope for cats. The smaller chest piece is more comfortable for the cat and allows more accurate localization of sounds. With this more active cat, letting the cat choose where to settle works better. Having the cat sideways can allow you to use your body to help to control lateral movement if required. You might ask the owner or an assistant to distract the cat by stroking its head to keep it still, and, as ever, minimum restraint will work best for most cats. The same principles apply to abdominal palpation. Make calm movements with the cat facing away from you. A hand on the sternum can maintain gentle control. Alternatively, have the cat sideways on and use your body as a soft wall. Here the swishing of the cat's tail tells us it's not happy, but the cat nevertheless tolerates the examination. For the cat that does not tolerate examination so easily, or if you need two hands to palpate the abdomen, use an assistant for minimum restraint of the forequarters, stroking and talking to the cat rather than gripping firmly. In a relaxed cat, to manipulate the forelimb joints or examine the forepaws, face the cat away from you and lightly restrain with a hand on the sternum, as we have seen before. It's easier to examine the hind limbs if you have an assistant to lightly hold the cat. Support the cat's weight with one arm under the abdomen and hold the cat to your body to minimize struggling. Alternatively, place the cat's hind end in lateral recumbency, but let its forequarters remain upright so that the cat feels less vulnerable. Here the flat ears and swishing tail tell us the cat isn't comfortable, but it will tolerate the examination as long as we remain calm, move slowly, and keep talking as reassurance. To examine the ventrum, proceed with caution. Cats feel vulnerable in this position, and few will tolerate being turned onto their backs by a stranger. Only try this if you have built a really good rapport with the cat. If you have an assistant, a better approach is to gently place the cat's hind end into lateral recumbency, again allowing it to maintain the front end upright so the cat has some feeling of control. Alternatively, the assistant can hold the cat with the forelimbs off the table and the cat against their body to prevent backward movement. If you don't have an assistant, placing the cat on your lap before turning it over and holding it against you while you examine the ventrum provides a very stable and comforting base, enabling the cat to feel more confident. To examine the head and neck, keep the cat facing away while you palpate the neck and the submandibular and prescapular lymph nodes. Examining the ears with the cat facing you gives the cat an opportunity to back away. It's easier to control movement with the cat facing away from you. Use the body and forearms to prevent movement and keep restraint light. Stroking the preauricular region also has a soothing effect and helps keep the cat calm. For a complete examination of the face and mouth, we will need to look at the cat face on. Gentle restraint between the assistant's arms and body and holding the forelimbs around or above the elbows controls the body and forepaws. Gently restrain the head, stroking the pheromone centres on the preauricular region and over the zygomatic arches as you examine the cat's eyes. Talk quietly and take a moment to stroke the cat in between examining different parts. Stroking the bridge of the nose can also have a calming effect. For most cats, examining the mouth is particularly stressful, so leave this until last. Utilise the pheromone centres and handle gently, lifting the upper lip to examine the buccal mucosa, teeth and gums. Make sure you get a good view of the whole of the upper carnassial, as this is a common area for pathology. Then tilt the nose towards the ceiling to encourage the cat to open its mouth to allow you to view the tongue, pharynx and medial surfaces of the teeth and gums. Be gentle and try not to force the mouth wide open. Stroke the cat as a reward when you're done.